All right.
Hello, everyone, and thank you for joining us today. My name is Mary Euler, and I serve on the APHA Foundation Board of Directors and the Women in Pharmacy Advisory Committee. Today, we kick off the Life Happens, Navigating Each Transition series, and I am excited to introduce our first speaker for this series, Dr. Adrienne Simmons. So Adrienne, I'm going to let you jump right in and get started.
Awesome. Thank you so much, Mary, and thank you for inviting me to share a bit about my career journey. I have had a few transitions in a short period of time, both planned and unplanned, and I'm excited to share a little bit about how I have navigated them. Before we dive into transitions, let me just share a little bit about who I am. I am proudly a Black, queer, eldest daughter, which in my opinion means that I've been leading since birth, but my siblings might just call it bossy. We'll leave it to them. Professionally, though, I am a pharmacist, an advocate, and a public health leader. I also serve as the Director for U.S. Policy Advocacy and Alliances at Gilead Sciences, and I'm originally from a small town in rural Virginia. I will have to tell you, though, that country life was a little bit too slow for me, and I've been thrilled to call Washington, D.C. home for the last 5 years. My educational journey took me throughout the South, starting at the University of Virginia in Charlottesville for my bachelor's, and then to Richmond, Virginia, to Virginia Commonwealth University for pharmacy school, and then finally to Chapel Hill, North Carolina, where I completed my master's and my residency program. And along the way, I've been extremely fortunate to have a lot of really wonderful mentors who saw potential in me, who challenged me, and who helped me grow, not just professionally, but also personally. And their guidance really helped shape who I am and how I lead and advocate and show up in this work. So let's talk a little bit about my career journey. It has taken me through very different sectors, starting with the hospital in 2018, followed by about 4 years in the nonprofit sector, then to government just last year, and then finally to the pharmaceutical industry. And even before that, I was a longtime pharmacy technician at a chain community pharmacy. My pharmacist journey, though, started at the University of North Carolina Medical Center, and this is really where I developed as a clinician as well as a health system leader. Then I moved into nonprofit work with the Hepatitis Education Project, and this is where I found deep purpose in community-driven public health. I then took a detour to HRSA and stepped into federal service, working on national HIV programs and really deepening my understanding of the government's role in public health. And now I'm at Gilead in the private sector, still focused on health equity, but really gaining new insight into how to drive impact in ways that I hadn't considered before. Each of these chapters has stretched me in different ways, and together they've shaped the leader and advocate that I am today. But this journey has not been without challenges, let me tell you. My first unexpected transition was finishing residency during the COVID-19 pandemic. So June of 2020, I graduated residency with no job offers and watched hiring freezes sweep across healthcare. It was a really tough and disorienting start, as you can imagine. I had done everything right, but the world had other plans. And this moment is really what pushed me to get creative, to stay grounded, and to just trust that the right opportunity would find me, even if it didn't look like what I had imagined. When I was job searching back in 2020, I had to cast a wide net. And so I took a risk and applied for a role that wasn't even looking for a pharmacist. They were really looking for someone who was passionate about advocacy as well as infectious disease. And so that leap led me to an organization called the Hepatitis Education Project. And I spent 4 years here leading a national coalition, helping shape hepatitis and substance use policy, and supporting providers and patients in advocacy efforts. Looking back on it, I think that I will always reflect on my time at the organization as one of the most rewarding and fulfilling chapters of my career. After those several years in the nonprofit world, I decided I wanted to broaden my skill set and to deepen my understanding of how government funding supports public health. HIV was actually my first clinical love back at the University of North Carolina. And so joining the Division of Community HIV/AIDS programs at HRSA really felt like a homecoming. And so for those of you who aren't familiar, HRSA stands for the Health Resources and Services Administration. And it's one of the lesser known federal agencies within HHS that plays a critical role in funding community health centers that provide care for underinsured, uninsured, and underserved populations. And so I was a project officer in DCHAP, shout out to the Central Branch, and I was responsible for overseeing HIV programs at these clinics. I was once again the only pharmacist on the team, but I was proud to be a public servant and to return to serving people living with HIV in a new and meaningful way. But that time was cut short, and I was returning from vacation in February of this year when I got a call from my boss's boss right there in the airport, letting me know that I was being laid off. And this came just 6 months after I had started my journey at HRSA. I was one of many probationary employees who was terminated earlier this year. I hadn't even made it home yet from my trip. I was told that I'd lose access as soon as I checked my email. And as you can imagine, it was emotional and honestly demoralizing. We attach so much of our self-worth to our work. We spend more time at work than we do anywhere else in our lives. And I was with a team that I loved, doing a job that I was deeply passionate about. And I remember feeling stunned, not just because I had lost my job, but also by how abruptly it had ended. There was no warning, no chance to say goodbye to colleagues, no closure, truly. And it made me reflect on just how fragile our professional identities can feel when they're tied so closely to our roles. I had poured myself into this work, and suddenly it was gone. But in that moment, I also realized something important, which is that transitions, even when they're painful, don't define our value. They really challenge us to recenter, to ask ourselves who we are outside of an organization or a job. And while this took a lot of time to process, the experience did remind me that resilience is so much more than just being able to bounce back. It's really about being able to find meaning in the face of transition. I am incredibly grateful to have landed something so quickly and so aligned with my interest. And so in May of 2025, I joined Gilead Sciences again on the government affairs team. It wasn't on my bingo card, but during my time at the Hepatitis Education Project, I had worked closely with Gilead Government Affairs. So they knew my work, they appreciated my approach, and thanks to a personal referral from a former colleague, I was able to step into a new role pretty quickly. I'm once again the only pharmacist in the department, and I'm part of our alliances team where I work with provider organizations to advocate for policies that impact people living with HIV. It's really a full circle moment and a reminder that both relationships as well as reputation really matter. If there's one thing that I've learned during this season of transition, it's that transitions are really invitations to grow, even if they mean you might feel uncomfortable. Our careers, of course, aren't linear, and that's okay. I've had to let go of a lot of roles that I've loved and step into the unknown more than once. But through it all, I've learned so much about myself and so much more that we are so much more than our job titles. After the layoff, I had to sit with a lot of emotions, grief and doubt and anxiety. But I also had to ask myself, what do I really want? What kind of work energizes me? And that reflection is what helped me move forward with more clarity and more confidence in my next role. Something else that I've come to understand in this season of transition is that in the workplace, we are all ultimately replaceable. And that realization was really hard. but it helped me shift my priorities. I've since learned, after lots and lots of therapy, to maintain a healthy detachment from my work while also still taking pride in what I do. I care deeply about the mission of the organizations that I've worked for, but I no longer tie my entire identity to my job. Instead, I'm focused on being a good person in other ways, being a good coworker, a good friend, a good sister, a good daughter, a good granddaughter, and hopefully one day a good mom. That's truly the legacy that I want to build. And so, I'll be the first to tell you that transitions can be tough, but they also teach us who we are and what we're capable of. And so I hope that my story encourages you all to embrace change with curiosity and with courage. I really appreciate you taking the time to listen today, and I'd be happy to take any questions.
Thank you so much, Adrienne. What a story. A short time frame, but a very, very interesting journey. I'm sure our audience has some questions. And so I'm going to look in the chat and see what we have. And otherwise, I have questions. So, but I'll see if the audience has any, and then we'll go from there.
Great.
All right. All right. Well, I will go ahead and ask a question that I have prepared. So, what factors did you have to consider when deciding to move from a government job into the private sector? Benefits, work environment, location, things like that. What are some things that you had to really, think about as you made that move?
Yeah, well, first I'll say that when you're facing a layoff, you oftentimes have very little choice in what comes next. And so, similar to the way that I found myself kind of casting a broad net following my residency program, I knew that I was going to have to explore all options following this layoff. There were a lot of really, really talented people in the Washington, D.C. area who were going to be looking for public health jobs all at once. And, I was ultimately very thankful to be part of the first round of layoffs before there were another mass round in April of this year. I really can't imagine competing in the job market now. So it's not lost on me just how privileged I was to land something so quickly. That being said, it did give me an opportunity to really give some thought to what I was looking for next, even if it meant that my options might be a little bit limited. And so things that I kept in mind were first and foremost mission alignment. I'm someone who, as you can see from the first two roles that I have, really care about the mission of the organization that I work for. And so I wanted to continue working on issues that I care deeply about, whether that was HIV or health equity more broadly. But it just turned out that I was going to be working those issues from a slightly different vantage point. I was also taking into account opportunities for professional growth. The private sector certainly offered new challenges and opportunities. Thinking about, are there opportunities for advancement if I'm here longer than a couple of years? But I really wanted to deepen my experience in building strategic partnerships and policy influence. So that was something else that I kept in mind. In terms of work environment and lifestyle, I'm someone who really values flexibility in my day-to-day work. And so my first job out of residency was completely remote. I had gone from sharing an office with 40 co-residents to working from home during the pandemic, exclusively remotely. And during those 4 years, while I appreciated the flexibility, I really came to miss having social interaction with people each day. And so I knew that in my next job, I wanted to at least have a hybrid role. And so my government job was actually coming into the office one day a week, which worked out well. I had an hour-and-a-half commute each way for my government job. There's no way that I would have been able to do that every day, but coming in one day a week, fed me socially and emotionally while also providing other flexibility in my life. In my current role, however, I come into the office 3 days a week. My commute is about 15 minutes, and I still am able to work from home 2 days a week. And so to me, that's the perfect balance. It's been really nice to have coworkers again, and to build friends at work. You quickly realize it's hard to build friends at work as an adult outside of work. And so it's been nice to build some new friendships along the way. And then the last consideration for me was benefits and job stability. I probably put air quotes around job stability, recognizing that, I was terminated from a job that should have been the most stable job of my career. And so I don't know that I believe in stability anymore. And certainly in the private sector, layoffs happen all the time. And so again, as part of me maintaining a healthy detachment from work, stability was less important, but things like benefits, compensation, having adequate time off, just having, good health benefits, all of those were certainly important to me as well.
Very good. Yes, but I was struck by what you said right at the very beginning, that you kind of found a silver lining in all of this. That you got laid off early, and so there's always something that that can make it not quite so awful.
Absolutely.
But very good. I believe there are some things in the chat here. Um, Oh, here's a question. What are the biggest differences between private and federal workspace? You may have commented a little bit on that, but let's hear a little bit more.
Yeah, I mean, the obvious ones are probably there's a huge difference in compensation. I had prided myself on, taking jobs that were fighting the good fight for a long time, but it also meant, and taking jobs where I was the only pharmacist, which meant that I wasn't making a pharmacist salary either. And so that has been probably the most obvious difference between the government and the private sector. You can, do really mission-driven work in the government, and I think it's a privilege to be able to serve the American public. But the trade-off that comes with that is that you're typically undercompensated compared to what you would make in the private sector. I would also say that, there are different levels of bureaucracy at every organization that I've worked at, whether it's government, nonprofit, health system, or now a pharmaceutical company. It exists on a spectrum. There's bureaucracy everywhere. I think that people hear government and they're like, oh, there's all this administrative red tape, and that is true, but there's administrative red tape everywhere. So to me, that hasn't been a huge difference. I will say, though, that it's been noticeable just how well resourced the private sector is. Something like getting access to a journal article in my previous roles was really difficult. And that's a resource that is freely available in my current job. Similarly, I think that there are brilliant people that work in all of these places, and we all are contributing different vantage points to this work. But the private sector does have its kind of unique lens, right? In the sense that ultimately you are working for a business. And so that perspective is always there. Whereas at the government, I didn't have to think about, that. I had to think about how to make the best use of taxpayers' dollars, which were very limited, but ultimately we would still, do the right thing if it meant that it was the right thing to do. In the private sector, there's a little bit, there's a little bit more conversation around that. Ideally, it makes both business sense and is, what's best for the common good. So there are just extra layers and nuances to each of them, but I've found that my skills have been very transferable through all of the various sectors that I have worked in.
Very good. Thank you. Here's a question, and you have a lot of experience in this, so let's ask this one. How do you navigate roles as the only pharmacist on the team?
Yeah, it's been fun. I will say that, the roles that I've been hired into, they haven't looked for a pharmacist because they have not been, the majority of pharmacist role. My roles and responsibilities are not the majority of a pharmacist task. That being said, I've found that there is a huge gap in the organizations that I've been a part of where pharmacist expertise would bring a lot of value. And so, for instance, in my first job in the nonprofit world, I worked for a community-based organization that by training, I was the most clinical person. And so our organization was headquartered in Seattle, Washington. We had a community health worker driven model. We did a ton of community outreach, testing for infectious diseases. We had a low barrier buprenorphine clinic that we partnered with a local FQHC on. And so we did a lot of clinical activities, but technically I was the most clinical person by training. And so, when people find out that you're a pharmacist, you get pulled into lots of things. I remember, we at some point were exploring the ability to store. We served a huge population of folks experiencing homelessness, and we provided hepatitis C treatment out of our organization. And people didn't have anywhere to store their belongings safely. And so starting them on a new treatment regimen could be challenging. And you have to think about, okay, where is this person going to store what is a very expensive medication? And so the question was brought to me of, can we have medication lockers? Which, as you can imagine, have lots of regulatory considerations. And so I was the person that kind of led the team through the thought exercise and knew who to contact around the Board of Pharmacy and talking to the Pharmacy Association about, is this feasible? And I don't think that without a pharmacist on staff, people would have known who to go to. Similarly, a lot of the policy work that I did was working with Medicaid programs around prior authorizations. And that it was really valuable for me to have a pharmacist lens into some of our policy and advocacy efforts, because it was ultimately pharmacists who were making those policy recommendations. And so to be able to have a conversation pharmacist to pharmacist about like, hey, I know that you're trying to do the right thing here. I know that you're trying to balance a really limited state budget, and this is how this policy is impacting marginalized communities. It was nice to be able to have a pharmacist having that conversation with another pharmacist, as opposed to someone else that didn't kind of speak the same language. So being the only pharmacist is fun. It can be challenging. It's an opportunity to educate people about the role of pharmacist. But I would just say I hope that there are more people even thinking about my short 4 months here at Gilead Sciences and being the only pharmacist in this department. A lot of the work that we do is pharmacy policy work or drug pricing policy work, right? And it feels like a disservice to not have more pharmacist voices helping shape some of those policy decisions. So if you take anything away from this presentation, it's that we need more folks, more pharmacists in policy spaces.
Very good. And thank you for what you do on behalf of pharmacy and helping people understand how much we have to offer. So thank you very much.
Absolutely.
Okay. I'm going to move on to another question from my list. Can you describe the environment and support that was most helpful to you when facing the reduction in force? And how can we then be supportive to other colleagues who are facing these types of challenges and uncertainty?
Yeah, it makes me so sad that there are still so many folks who are experiencing this right now. I mentioned that, I was very thankful to be part of the first round of layoffs. The trade-off, though, was that there weren't a lot of resources in the early days of my layoff. And so, now there are job boards and newsletters and job fairs and groups on LinkedIn that share various job opportunities. And there just wasn't as much of that in February of this year. And so what I found really helpful was, reaching out to folks in my network. Even if it had been a long time since we connected, people were still very, very generous to have a coffee chat with me or to review my resume and give me feedback or to even refer me for jobs. And so colleagues in your network, I would say, are a critical source of support during this time. In terms of emotional support, you have to figure out who your support system is. But for me, that was friends, family, that was my therapist, but it was also volunteering. And so, I found out very quickly that I needed structure in my day. That was the first time in my life that I hadn't worked. I had been working since I was 16 years old. And so it was really unusual to wake up and not have something to do for the day. And so I said, I've got to make some use of this time. I can't spend 8 hours a day applying and interviewing for jobs. And so I chose to put my volunteer efforts towards the National Pharmaceutical Association. So just really leaning into my role as a board member during that time helped provide some grounding for me and structure to my day-to-day work. I will also say just a very simple thing was just taking a walk every day, getting outside, getting some fresh air, feeling the sunshine on your face. You don't realize just how important it is to not be in your house all day, every day, for months on end. And so, yeah, a combination of, my friends and family as a support system, folks in my professional network sharing jobs with me and providing feedback on my resume, as well as therapy and just getting outside and volunteering were things that worked best for me.
Thank you. One of my questions was going to be, how did you take care of yourself during this stressful time? But you have really have talked about that quite a bit. So I'm not gonna keep asking that question, but let's go to a different place. So what advice do you have for individuals who are just beginning their job search process?
Yeah, it can be a really daunting process, and it's a really isolating process too. I think that despite there being so many people who are in the situation right now, my guess is that most people are going through this alone, and that makes it all the more challenging. When you think about the fact that like you got to be submitting applications and then hopefully you're getting interviews, which means that you have to be on, and you kind of have to compartmentalize the fact that like you feel this crushing anxiety and grief and stress, financial stress. Like, how am I going to survive how am I going to pay my bills next month? Am I going to burn through my savings if you have savings, right? And so you have to compartmentalize a lot of that during the job search, because you also just have to submit applications and show up and put a smile on your face like everything is fine. And so, my advice is to first really take some time to reflect on what it is that you're looking for. Again, recognizing that your options might be a little limited, so keep an open mind. Also, it's good to like know what really gets you excited, but also keep an open mind in case that opportunity just isn't available. Some of this is all about timing. Networking very intentionally, reaching out to people in roles that are of interest to you, even if that organization doesn't yet have a role for you. Reaching out just to get to know people is always really helpful. Making sure that you are tailoring your resume for each job that you're applying to. I think it's easiest to just submit the same resume to every job, but there are so many people that are applying to the same role that you really do have to take the time to tailor it and make sure that the resume that you're submitting speaks to the role. I personally use like a master resume that's a few pages long that has all of my accomplishments and experience on it, and then I just delete stuff as I'm applying to a role. I delete it. If it's not relevant, then I don't include it on that version of the resume that I'm submitting. But that was kind of an efficient way to figure out what might be most important for a job. Staying organized was also super important. I had a spreadsheet of all the roles that I had applied to, the status of my application or interview, when I needed to follow up with a person. So organization certainly helps. And then finally, just give yourself grace. I hopefully have driven home the point that a job search and layoff is highly, highly emotional. So, celebrate the small wins, and try not to take rejections personally. Make sure that you're making time to do things fun in your life. But yeah, it's, just know that like this is a hard time and there's no perfect answer to how to navigate it. The best you can do is to try to create a support system that will help you through all of the difficulties of it.
Wonderful. Well, thank you so much, Adrienne. You are wise beyond your years. You
Oh, thank
provided some
you.
absolutely wonderful information and help for all of us on this call. So on behalf of the APHA Foundation and the Women in Pharmacy Advisory Committee, I just want to thank you for taking the time to be with us today. And to all of you who are on the call, if you'd like to learn more about the Women in Pharmacy Initiative, please visit the APHA Foundation website, aphafoundation.org. pharmd.com/women-in-pharmacy. And we'll see you next week for session 2, the Pharmacist's Career Roadmap. Thank you all, and have a great day.